Young people needing help with their mental health have reported shortcomings in transition to adult services. In Sheffield, responses to these problems include voluntary sector counselling services, peer support transition groups, and a transition clinic. They're all directly addressing some of the issues raised by young people themselves. Sheffield has a combined health and social care trust.
We're integrated between health and social care, so social workers are still employed by the local authority, but they're managed within the trust and they're part of our community mental health teams and quite a number of other services too. So we see ourselves as trying to work as holistically as we can with service users. In many places, CAMS, the Child and Adolescent Mental Health Services, work up until 18. In Sheffield, they're only commissioned to work up until 60. So the PCT fund us to work with people from 16 upwards. And there are some challenges there, I think.
What happens next for these young people is crucial, with the aim of reducing their anxiety and improving their engagement with adult services. A transitions clinic is being piloted.
Come in and have a sit down.
CAMS psychiatrist Dr. Joy Owens is introducing Chloe in person to the adult service.
Chloe, this is Helen, Dr. Grimlisk, who is the adult psychiatrist from East Glade Adult Mental Health.
She's centrally involved in the discussion about her own future.
How have you been since we saw you last time? How have things been?
Now I've had the help off of CAMS and everything. It really has helped me get through, really has helped me get through school. I don't think if I don't think I've come here, then I wouldn't have been at school.
Now that you're 16, the way things work here in Sheffield is that you come over to adult services. Now, what we need to do today is just think a little bit about what you want from that, how we plan that.
When Chloe's punched windows and doors, and she's quite scary. And I sometimes I look at her and I think, oh, there is a mental issue there, more than just a hyperactivity type thing, and it's a bit scary for her going into adult with them symptoms. Like
the ADHD, it doesn't give you that thinking time, so an emotion comes into your head and you don't think about the consequences of doing something, you just go off and do it. And one of the things that the medication does is to give you a bit of thinking space. But so you can learn that as well. There are ways of learning, and as you get older, you'll find that becomes a little bit easier. I think for Chloe, it's a way of making a link with adult services, seeing a face rather than just getting an appointment. We had, before we set up this system, we had a real problem with young people being referred from children's services to adult services and then not turning up at adult services.
They just kind of got lost really between the ending of their plan of care with our service and the next, sort of step to adult mental health. And we realised that, there was this gap and that, we needed to try and do something about that. So we set up the transition clinic.
The clinic's useful for clinicians too. The next session brings up information not covered in Jessica's referral letter.
We're meeting you both today because you're now 16, and if you want to continue on medication, then we need to transfer your care over to adult mental health services. And how are you getting on with the medication?
I missed a day, and then after that I was hearing voices, and then I went back on it and they went.
And did the voices say anything to you?
I walked to the shop with my sister and we were arguing. And they were just saying like evil stuff.
If you were to have any more of these episodes where you hear voices, we'd really like to know about it, because occasionally the medication can cause that as well, and we wouldn't want that to happen. So do let me know if that happens again.
The fact that she's met Helen and engaged with her means it's much more likely that she will go to her first appointment and continue engaging with that service. It does take a huge amount of planning, but it's definitely worth it when you see, the outcomes and you hear about people from Helen who've gone on to their service and having a really good outcome.
Mental health in the world beyond CAMS might depend on adult services, but they usually have a very different feel and emphasis.
Because we're an integrated health and social care trust, we may have access sometimes to social care ways of responding to people's needs that are more appropriate for individuals. We're very, very keen on the recovery approach within the Trust. Recovery isn't just about getting better. Recovery is getting your life back, feeling more in charge of your own destiny, even if you are still struggling with some of the symptoms of your mental health problems. Clearly, 16 is a crucial age in terms of individuals' development anyway. It's a key time in that transition from the dependence of childhood to the independence of adulthood.
This pilot transition group bridges the age span of 16 to 25.
In adult services, the responsibility is much more on the client. That can be quite daunting for people who've come through CAMHS and it's been quite intensive, to now being in adult mental health services and maybe having a little bit less input from us. There's only so much that we can do without almost creating a dependency that's unhealthy.
Young people support each other and learn together about managing their own conditions.
More you know about your illness, better you'll be able to cope with it.
Yeah. I'm a bit hesitant about coming to a group, and I found it that I've made friends, I've been able to get a lot more off, and I've distressed myself a lot better now.
They've not always enjoyed school. Mental health can improve just by being in a supportive peer group and building social skills.
Before I'd come into this group, I wouldn't really like to talk to new people, or I'd stick to, but now I'm not as shy. I'm not as shy as what I used to be.
It's become part of their routine to come on a Monday, and so where maybe the rest of their lives are quite chaotic, this is one thing that is stable.
I like to know what I'm doing from next day to next. If there's nothing there, then there's no point in doing anything.
There can be lots of changes. One of the people referred to the group was pregnant, lost the baby, tried to come to the group, couldn't, tried to go to an apprenticeship, couldn't. So there's lots of different events going on to try and work through. And I can think of lots of different situations with these young people where there's significant events going on in their lives and they just don't always know how to deal with that.
Young people leaving CAMHS don't always feel a need or meet the criteria for statutory adult mental health services. Even if they do, the demands and perceived stigma often mean they drop out. In downtown Sheffield, a voluntary counselling service shares a building with other resources they might want to use. So at times to suit them, and without feeling stigmatised, it's easy for them to drop in.
It's a sort of one-stop shop approach so that young people can come in and feel comfortable within a building. You know, it's not identified, for example, we've not got a big label outside that says this is where you come for counselling, you know. So it's very much anonymous when they arrive. For many of them, they've been in and out of different services over a number of years before they come to us. Sometimes really engaging with services at CAMHS level up to 16, but then very much feeling abandoned when they get to 16 and really feeling like they've fell through a hole.
I went to doctors and they just sort of said, oh, what do you want me to do about it? And offered me medication, which I didn't want because I wanted to try and sort myself out a bit, as it were. I basically ended up looking stuff up myself and sort of finding things and contacting them myself, which I sort of thought a lot of people with mental health issues probably aren't going to do.
In terms of resources, I think it's worthwhile to put the time and the effort in now. And hopefully prevent ongoing sort of the revolving door syndrome of people coming back or getting stuck, and hopefully we're equipping young people now so they can go on into their lives and do positive things and be the people that they want to be. I
feel like I've come on leaps and bounds since I'm not as immature as I was before I started. I don't have no flare-ups or out like that anymore.
Clearly, if individuals fall through and don't get the service they need, they're then high risk, their mental health deteriorates and they come back and there's a more costly service response. There's quite a conflict between the payment by results agenda in health and the self-directed support individual budget agenda in the local authority. So I can imagine that some areas are struggling with those tensions and resolving them wrongly, in my view, by divorcing. And it has been quite difficult in some areas. But in Sheffield, as I say, we're confident that we can meet those challenges.
Not all young people will be attracted to our service, and not all young people will be attracted to CAMS or adult mental health services. But I think between us, if there was that level of co-creation and commitment and communication, I think we'd have a lot better shot at actually developing services that young people were interested in tapping into.
Transition can be tough, but the right support makes a difference, and it doesn't have to break the budget.